Hi there, happy Thursday everyone, and thank you for joining us today for the first education session presented by the HNHB French Language Services Community of Practice. Before we get started and that I pass things over to our guest speaker, I'd like to take just a couple minutes to provide a little bit of context on how this initiative came to be. So my name is Bianca, first of all, hosting the webinar with my fellow health planners from the French language health planning entity, also named Entité 2. We may be using those terms interchangeably today just out of habit. For those who may not be familiar with our organization, we're mandated by the Ministry of Health to inform planning and improve access to French language services. There are 6 entities across the province, and Entity 2 or Entité 2 covers both the HNHB and the Waterloo-Wellington territories. And the way that we do that is we have a, is that we engage the Francophone community and stakeholders by informing and consulting with these community members. We support planning at the local level, for example, through the LINs and in provincial strategies. And we also support health service providers individually to build capacity within those organizations and improve delivery and access to French language services. So a little bit of background about the community of practice and how it came to be. So earlier in 2019, the entity supported by the HNHB LIN went out into the community and met with all of the health service providers that are identified to plan and deliver French language services. And through those meetings, we noted that there was some knowledge gaps in terms of French language services. Certain things such as identification and designation requirements, what it meant to be identified, what it meant to be designated, available resources to these organizations, as well as the role of the LIN and the entity and how they can support HSPs in French language service delivery. So in the elaboration of the LIN entity annual action plan for the 2019 and 2020 fiscal year, we decided to establish a community of practice as a means to share information and standardize the knowledge and the understanding of French language service requirements and the obligations amongst HSPs and stakeholders. We did want to make sure that by creating a community of practice, that the information that we were providing or the environment that we were setting up would obviously meet the needs of the providers, and we wanted to make sure that they felt supported in terms of delivery of French language services. So the entity and the LIN opted to create a collaborative model with a steering committee that has been created, which is composed of willing partners. The steering committee has had a couple initial meetings to lay the groundwork for the community of practice. So shaping the community of practice and the objectives, elaborating an initial work plan, and we've gathered some relevant documentations and resources in order to set up an information hub as it pertains to French language services. And we'll come back to this a little bit later in the webinar and provide a little bit more information. The purpose of the community of practice is to create a structure that allows health service providers to connect regularly, to support practices within each individual organization. More specifically, we hope that the community of practice will improve access to resources, support knowledge exchange, and foster collaboration amongst HSPs. In terms of community of practice membership, we have decided to not instill some strict boundaries. We want to make sure that there is increased access to resources, and so membership is inclusive to all. And again, we hope that these resources will improve access and increase delivery of French language services. So once again, to make sure that the information provided today and in future sessions continues to be pertinent for the health service providers and that they meet your needs regarding French language services, we'll be circulating a survey following today's webinar to inform future planning of events, whether it be in the form of webinars or other networking opportunities. And we definitely appreciate everybody's input, as this will be critical in making future initiatives successful. When you signed up as a participant to this webinar, your email will be added to a distribution list for future events. If you do not wish to be included on the list or wish to be removed at any time, feel free to let us know and we will get that done for you. Just quickly, some housekeeping items. All attendees of the webinar have been muted. If you do have any questions that come up throughout the webinar, please feel free to submit those in the Q&A tab at the bottom of your screen, and we'll address those at the end of the presentation. So without further ado, today's presenter is Louise Baillargeon, who is the manager of the Translation Network. Louise will tell you a little bit more, but the Translation Network provides translation services to health service providers provincially who have been designated under the French Services Act or have been identified to plan and deliver services in French. And she'll be able to elaborate a little bit more on the services that are available to organizations. So I'll pass this over to Louise.
Thank you, Bianca, and bonjour to everyone. As mentioned, I'm the manager of the French Language Health Services Translation Network, and I'm also the translator responsible for Southwestern Ontario, including the Hamilton, Niagara, Haldimand, Brant area. I am based out of Niagara Health's Welland Hospital site, which is the host agency of our program, and I've been part of the Translation Network for 27 years now. Before starting, I'd like to note that my comments will be quite general, as many participants do not have access to our full translation services, and I'd like to try to keep this as relevant to them as possible. First, I'd like to explain the difference between translation and interpretation, as many people don't realize they refer to two different but related concepts. In short, interpretation is oral. It refers to listening to something spoken and expressing it orally in another language, most often in a live setting. The Translation Network does not provide any interpretation services. Translation is written. It involves transferring ideas expressed in writing from one language into another language. Some think that bilingual employees are able to adequately perform translation tasks, but that generally is not the case. Becoming a professional translator requires education, training, and experience to fully learn all the skills and techniques involved and to understand the details and nuances of language and language transfer. Translators do not translate word for word, but rather convey the intent of a message clearly and accurately, using the right words while avoiding language pitfalls. The message often needs to be adapted so that it is culturally appropriate to the audience. The Translation Network is fully funded by the Ministry of Health. It was created in 1990 to assist identified and designated health service providers, or HSPs, in providing quality written material in French to the general public through translation of resources from English into French. We provide free, comprehensive, quality translation services to approximately 340 HSPs across Ontario. The network is comprised of 6 professional translators, including myself, and 4 translation coordinators, one of whom works with me. Each translator is responsible for a specific geographic area. In our office at Niagara Health, we provide services to HSPs located in Hamilton, Niagara, Waterloo, Middlesex, Kent, and Essex regions. I will give an overview of the network translation services before explaining other ways in which we are able to support HSPs, whether or not they have access to our translation services. I invite those who would like more detailed information about specific aspects of our translation services to contact me directly. To have access to our services, HSPs must be designated under the French Language Services Act or have been identified to offer French language services by the LIN, and the documents to be translated must meet our eligibility criteria. The Translation Network only translates from English to French. We are able to translate various types of resources intended for the general public. For our purposes, general public includes patients and clients, families, residents of long-term care facilities, schools, etc. Because we translate only for the general public, we do strive to use plain language as much as possible so that information is clear and easily understood. We also make an effort to adapt resources to meet the needs of francophones. For example, if a document provides supplementary resources, such as books and website links that exist only in English, it is important to also provide alternate French, or bilingual resources. Here are a few examples of the many types of documents we are able to translate. The full list appears in our translation guidelines, which are posted on the entité's website, or which I can provide to you. We can translate patient education and information documents such as brochures, fact sheets, patient guides, and videos, as well as consent forms, other forms, and surveys. We can translate correspondence to the general public. I had previously mentioned that we translate only from English to French. There is one exception. If you receive correspondence in French from the general public, we will translate it into English so that you can find out what is said and respond if necessary. We also translate signage, job postings where French is mentioned as a requirement or asset, as well as information for websites and social media, annual reports, news releases, and many others. Documents can be sent to us in Word, PowerPoint, Excel, or Publisher formats. We then simply replace the English wording with the French, enabling us to preserve your initial formatting. We do also accept PDF files, but the translation is returned as a basic Word document. We generally translate small documents and updates in-house and contract out the rest to freelance translators. I then review all translations before returning them to clients, which allows us to ensure not only quality, but also consistency in terminology and phrasing, as well as readability level, among other things. Here are some examples of what we cannot translate. Internal documents intended primarily for staff, as well as documents intended for healthcare professionals or other HSPs. Patient files, documents for programs that are not base funded by the ministry or the LIN, and by ministry I mean the Ministry of Health. Copyrighted documents, unless the HSP has obtained written permission to translate from the copyright holder and provided it to us. We also cannot translate material for research projects and clinical trials or documents of a provincial or national scope. Again, the full list appears in our translation guidelines. Clients who reformat translations are expected to return them to us in PDF format for proofreading. Turnaround times are quite quick, usually 24 hours or less. When proofreading, we ensure that no French text has been omitted or English text inadvertently left in a document, and the line breaks are in the appropriate spot. We also ensure the French typography rules have been followed. For instance, in French, capitalization and punctuation rules are quite different than they are in English. From time to time, we are asked to review or to correct material that has been produced in French by HSP staff. That is unfortunately not a service we are able to provide. In such cases, it's simply best to send the document to us for translation. To access our services, you'll need to complete a request for service form. Please contact me to obtain the most up-to-date version. You can also find it on the entité's website. If sending a series of documents, it's easier to complete just one form for the entire project. Be sure to give a deadline and to indicate if it's a firm one. Send the form along with documents to be translated by email. For time-sensitive projects, please contact me ahead of time so we can be sure to reserve a translator. Also, I ask that you contact me to discuss the feasibility of large projects. When sending time-sensitive or urgent translation, please follow up to make sure we have received the message. An urgent translation would be an unforeseen situation impacting the public and for which immediate action is required. These are very rare. A couple examples which have occurred in the past include H1N1 translation and translation stemming from a meningitis outbreak in a school. These are given top priority. We would set aside whatever we are working on, and if required, call on other network team members and our freelance translators to do the same so that we can provide quick translation. Forgetting to have a required document translated or leaving it to the last minute is not considered urgent translation. I can't stress enough how important it is to consider the translation process in your planning, especially if you have tight deadlines. Please remember that we are translating for a large number of clients and have many deadlines to meet. As a trusted partner and ally of HSPs, the Translation Network endeavors to offer other services to both identified and non-identified HSPs. I believe I've already mentioned that we can provide linguistic consultations to people who are struggling with the translation of a word or perhaps with phrasing. You can send that by email or just give me a quick phone call. We can also connect you to the freelance translators with whom we work regularly if you don't have access to our services. if your documents do not meet our criteria, or if we can't meet your deadline. Our freelance translators are all professional translators with several years' experience. Most work independently and not in translation firms. Their rates are generally lower than those charged by such firms. The use of these freelance translators ensures consistency, accuracy, and quality, as they are familiar with the HSPs we work with the terminology we use, as well as with the Ontario health system. We are often asked if HSPs can pay us to coordinate this process, but we are not set up to receive funds and cannot do so. In the past, the Translation Network produced quarterly lists of materials translated throughout the province by theme. Users could see what resources had been translated on a specific theme, and if documents were of particular interest to them, could contact the HSP in question to obtain more information. The lists were widely distributed across the province. They have, however, not been produced for about 2 years now. We found they were not user-friendly and had become much too long. We will, however, be surveying clients in the new year to gauge their interest in these lists. In the meantime, we are able to generate lists on demand, so don't hesitate to contact us if you would like to find out more or obtain an example of these lists. Now I realize I've skipped a little section here, so other services we can offer, or that we can make suggestions also, back to freelance translators here, we can make suggestions to those who are using freelance translators, for example, on ways to reduce costs. We can also provide you with the names of firms who are able to translate into other languages. That is a request we get quite often, as some people are also looking to translate into other languages like Chinese, Arabic, Italian, or Spanish, for instance. We can also recommend language resources for your bilingual staff, such as dictionaries, writing assistance software, and useful websites that they can use in preparing their own communication materials. We can also provide advice on other aspects of French language services or production of French resources. We are also able to act as a clearinghouse by providing access to existing translated resources. HSPs, whether or not they have access to our services, can contact us to see if we have already translated documents that may meet their needs. I'll give you a few concrete examples. A long-term care facility that does not have access to our services could contact us to see if we've already translated mission agreements or client rights for other facilities. Or a hospital with an immediate need for patient information on medical assistance in dying, or a community health center or health unit asked to provide a presentation on the risks of vaping, could also reach out to us, allowing them to obtain French material quickly without going through the translation process. Likewise, a local branch of a provincial or national organization like CMHA or the Alzheimer's Society might want to explore the possibility of accessing resources that have been translated for other branches. In such cases, we would consult our database and our colleagues in other offices to see if we have already translated such documents. Doing so avoids duplication of resources, saves money, and gives quick access to translated material. Please note, however, that we aren't able to share the actual documents in English or French, as they belong to the HSP who submitted the request. We can give you the contact information of our resource person so that you can request a copy of the document as well as permission to use it. That said, if the English document or its translation is available online, we could give you the link so that you can first determine if it meets your needs. In some cases, the Translation Network can also act as a liaison. For instance, we may be able to connect you to contacts in other HSPs, the LIN, or the Entité. A recent example is that we were able to put public health nurses working in Southern Ontario French schools in touch with each other. They have since formed their own community of practice, have their own SharePoint site, and are able to support each other, share resources, and avoid duplication. Identified and designated HSPs can also request statistics on their own use of our services. For instance, on the number of documents or words they've had translated over the past year, or the past quarter, or the past several years. We can also prepare a list of all the documents they've ever had translated, or documents translated within a set period of time. I can't make a presentation on translation without addressing the use of Google Translate. Google Translate and other machine translation tools have certainly come a long way. They can be useful for getting the general idea or the gist of a document, or for translating an internal document that will not be seen by the general public. However, when providing information to patients, I'm sure you would all agree that it's crucial to provide accurate, reliable information and instructions. Machine translation is simply not able to produce such translations. Machine translation software can't think or ask questions. It cannot interpret text, read between the lines, or understand humor and sarcasm. It translates very literally. It cannot accurately translate documents which are poorly written and ambiguous, have long sentences, or in point form. It cannot decipher the context in which words are used. When words have more than one meaning, it often does not know which one makes sense. Here are just a couple examples. Depending on how a sentence is structured, it doesn't know if the word cold should be translated as froid, referring to temperature, or as rhume, referring to an infection. Or if it should translate speaker as an haut-parleur or as a conférencier. One refers to a sound system and the other to a guest speaker. There are many other examples. We tend to chuckle when we see some of the results in print, such as the example I've put up on the PowerPoint for those who read both languages. But in healthcare, it's no laughing matter. Using such translation tools can jeopardize patient safety, expose you to significant errors, risk and liability, and even ridicule. Furthermore, Francophones will likely be insulted by the often incomprehensible translations. I certainly encourage you to have access to our services rather than to use Google Translate. If you have any questions about our services or about translation in general, feel free to contact me by phone or email. I remind you that you can obtain our translation guidelines on the Entité's website or by contacting me directly. I will pass over to Bianca, who will have a look to see if you have any questions.
Merci, Louise. So as Louise mentioned a couple times, those who want more detailed information about eligible documents and access to the form to submit a translation request can be found on the Community of Practice website. Just a quick word about that. So for the time being, the webpage is actually hosted on the Entité's website. I've shared the link. You'll find not only Louise's documents, but you'll also find resources regarding French language service navigation, identification and designation requirements, access to some training opportunities as well. So if you have a few minutes to go take a look at that, you may find that information useful. And again, if there's any questions, feel free to reach out. So that being said, if there are any questions, okay, so first questions. Can I confirm that you are not able to provide services to Ministry of Children, Community, and Social Services funded programs, for example, children's treatment centers? So I'll turn that over to Louise.
Yes, unfortunately, we are only able to provide services to those agency or health service care providers who are funded through the Ministry of Health. For the last few weeks or months, we've been able to provide services to for children and youth mental health services, which have been transferred to the Ministry of Health from the former MCYS, but we do not translate any other documents, unfortunately. We can, however, provide you with contact information for translators.
So if there were any other questions, if you'd just like to submit those in the questions and answers or the Q&A section. To confirm, you also provide translation for Ministry of Long-Term Care. Yes, it's okay. So Louise confirms that yes, she does. Can you send the slide presentations to participants so that we can have this info for future reference? Absolutely, we can take care of that on our end. So we will send that to you when we send out the survey. So in the next couple days. last call for any questions. Just waiting a couple minutes to see. Question? So I'm just going to repeat the question for those who are participating online. So here in the room, there was a question about translating electronic signatures. And so since there's a variety of titles, is that something that can be sent to Louise for her to take care of?
And yes, any such translation could be sent to us just, you could send it to us just in the body of an email if it's just a few titles, or you could send to us in a Word document the full list of titles for which you require email signatures. And then with the request form for the request for translation by including a deadline. And we'll happily get that to you. One topic that I did not address that most people often ask is turnaround times. And it's a very difficult question to answer as that really fluctuates from time to time. It fluctuates based on the demand for our services. It ebbs and flows. We have very high demand periods and lower demand periods. So it really is on a case-by-case basis. We don't have a set amount of time, but we will contact you if the date you have indicated will not work for us.
So just another question here. So we provide service to francophones in the Welland area. Many times they seem they seem confused with the translation as it is possible. Is it possible, sorry, I'm trying to just make sense of this. Is it possible to have translation done to accommodate their need? It seems that their French is a bit different.
Yes, I'm not sure if you're referring to documents that have been translated through our offices or not. We do make an effort to ensure that we're using a proper literacy level for the community. Sometimes the French words are a little more complex than they are in English, and we do always strive to make sure that we are using correct French. If there is any problems though with particular documents, please let us know and we can address those. We can rewrite the document. We can look at ways we can lower the literacy level together so that we are meeting the needs of everyone. Of course, the major role of translation is to communicate a message, and we do want to make sure that the message is communicated effectively to users.
So just a follow-up question to that, should they advise what population the message should be addressed to prior to requesting the translation?
Yes, on the request form, there is a question about who the intended audience of the document is. So if someone does specify, for instance, the document is geared towards youth, we will make sure that the document, that the language used is consistent with what youth would understand. Or if perhaps your population tends to be require an extremely low literacy level, please tell us. Please send us an email too, maybe to specify that.
Great, thank you. Another question: can you explain further about the process to request for translation of documents?
Okay, to request a document, you simply need to complete the request form and to email it along to myself. The address is provided on the request form, and with the accompanying documents to translate. You'll need to be sure to indicate a deadline. We will assess its eligibility, and from there we will send it off to a freelance translator if it's a longer document. We would certainly encourage you to provide us with any existing terminology or to define any acronyms that are used. As we translate, we would get back to you if we have any content questions. We would return the document to you in the format in which you sent it to us, unless it was a PDF document. If you have any specific instructions, we would ask that you include those. And also contact us to be sure that we receive the message if the file size is quite large. Sometimes our servers will reject documents that are in excess of maybe, or files that are in excess of 15 or 20 megabytes, and we will make other arrangements to receive those. Likewise, we're unable to receive any documents which are compressed in zip files too. I hope I've answered that question.
And again, I think that information is all detailed in the guidelines. So again, available on the Community of Practice webpage. And yes, so not seeing any other questions. Oh, sorry, another question.
Like in the case, for example, of a group working on the website, if they want to ensure that they're publishing the website in French and in English at the same time, do you have recommendations on how to manage that? It's challenging. You do that kind of work and have the final version ready. So if you want to publish it at the same time or broadcast it, you have do your full English, everybody agrees, we have consensus on the content, and then you translate afterwards that you have. So I don't know if you have.
So I'll repeat the question. So the question is regarding websites. So if an organization or a group is looking to publish a website in both English and French simultaneously, if Louise had any recommendations as to how to go about that, since it may be difficult to have, for example, all of the English content ready before sending out for translation for French, and the time that would possibly take.
For such a large undertaking, I would certainly start by letting us know ahead of time, by giving us a heads up that this is coming, and your expected timelines. We do ask that only final versions of documents be submitted to us for translation, because it's extremely time consuming and expensive to go back and make changes as each round of edits is done. So if you had a large document of that nature, we would ask that you send it to us only once it's finalized. However, if we know it's coming, we could have somebody booked ahead of time, ready to work on the project with the deadlines established well ahead of time. Another option, depending on how your planning stages go, is you could send it to us in chunks as soon as each chunk is complete. In such a case, I would still try to return the whole document to you at the same time to ensure a final read-through, to ensure consistency from beginning to end. And then before you actually post it and go live, I do like to essentially do the proofreading even of the websites to make sure all the information transfer has been done accurately. I hope that answers your question.
And maybe just a follow-up question to that, because I think that's come up before in conversations that we've had between Louise and ourselves. If I'm not mistaken, if an organization is looking to potentially translate part of their website, you may be able to steer them in the right direction. It may be daunting to certain organizations to translate their entire website. So correct me if I'm wrong, but well, I'll let you answer.
For a large website, it's honestly not usually feasible to do the whole website at once. It's cost prohibitive, and some of the material on the website may not meet all of our criteria. Website eligibility criteria are the same as any other documents, so sections of the website that are for internal use, for other agencies, or for other health professionals would not meet our criteria. We would look at the website with you and determine which are the priority sections, and those would be the documents that are required for the patient or the client to access French language services or to improve active offer of French language services. So we would start by those documents and go through section by section with you and determine how to proceed. And in time we would get the entire thing done. We would be able to in time get everything that is admissible translated.
Great, thank you. So not seeing any other questions. Just a quick thank you before we wrap up. First of all, to the French Language Service Community of Practice Steering Committee, who's helped, as we said, lay out the groundwork for today's webinar. The LIN, who's also a partner in the Community of Practice Initiative, Pathstone Mental Health, who graciously offered their boardroom today for today's webinar, and of course Louise from the Translation Network, who offered, I think, a lot of great information today, which hopefully was relevant and helpful to those participating. Once again, I'll share both Louise's contact information as well as ours at Entité Deux. And so please feel free to reach out as you see fit if you have any questions about either today's content or any questions regarding French language health services. And with that, I will say thank you again for participants, and we hope to see you all the next time we offer an education session. Thanks so much.